The next question is, if a mother donates a kidney to her son, this is the example of which kind of graft? So there is a option A is the Isograft, option B is the Allograft, option C is the Autograft, and the option D is the Xenograft. Okay, so anybody with the answer, please do respond. So your answer would be allograft. So your allograft would be your answer, right? So let's see few things regarding this topic. So here the allograft is that the transplantation between different genetical individual of same species. Okay, and that is supposed to be different genetical individual of the same species. So that could be either sibling to sibling, that could be mother to child, father to child, or some unrelated donors as well. So everybody comes under the different genetical individual. So here the most common graft that has been used in case of organ transplant. Okay, so in most of the type of the organ transplant, we basically use the allograft in that case. So like in case of renal transplant, there is a liver transplant, also there is a corneal transplant as well, where we are using the allograft very widely. But obviously there is a problem. Why? Because they are not done within the identical uh, genetical individual. It's like they're basically done with a different genetical individual. They're not done with the identical genetical individual. That will leads to the like high rejection rate. So this high rejection rate is basically tackled with immunosuppressive therapy. So this immunosuppressive therapy is basically provided to be very much essential just to prevent host versus graft rejection. So as I have said, so they are basically associated with increased rejection rate, which is very obvious because of their genetical disparity. Okay, so there is a 4 types of graft has been there mainly. So there is a isograft. Isograft is basically between the genetical individual. So genetical individual means they are basically done within the identical twin. Okay, identical twins. Now then comes there is a autograft. Autograft is basically done in case of same individual. So same individual, like the skin graft is basically taken from the thigh to arm. Then comes your allograft, which is basically genetically different individual with same species, right? So the genetical different individual with the same species kidney is like in this example, like in this question, as there is a kidney has been transplanted from the mother to son, it's basically an allograft. Okay, and then comes the xenograft, which is between the species, like pig heart valve into the human are basically transferred. So there is isograft, that is between the identical twin. There is a autograft that is basically done within the same individual. Then comes the allograft, which is done in case of genetically different individual, and there is a xenograft which is done with different species. Okay,